be happy that and we have a lot of editors like on the PowerPoint, as you can see, and we do the beautiful posters because of their dedication. And let's see like how wonderful this doctor is. And on the screen, we see a grandmom caring for his little young baby. But without our doctors, then maybe this image would not have happened. And actually, the women just suffered from, and I really had a kind of a frequent urination, and I got a tumor in my ovary, and when I went to the doctors, and I didn't receive any effects there. Therefore, I went to Dalin慈济Hospital, and we give them some chemicals inside her belly around 90 minutes, and we keep the temperature of the liquid warm up to 41 to 43 degrees. So we can use the temperature and make the chemical therapy more effective. So Mrs. Zhang's tumor got shrinked just really healthily, and this is a very, very good remedy for women suffering from such diseases like ovarian cancers or stomach cancer. So through the treatments, Mrs. Zhang recovers very well, and she really appreciated Dr. Xu really much. And I can be reborn, and I'm very, very grateful towards you. I was pessimistic, and I'm lucky enough that I had you in my life. So I really, really carry my sincere gratitude toward you, because so my son is named Liu Shuo, which is carrying gratitude toward you, Dr. Xu. And from this poster, then we can see how hardworking he is. And let's talk about, the urination part. And some ladies just get like a wet belly, okay, when as they are walking. So how many times do you go to the bathroom at night? Oh, I go there, once every hour. In winter, and I got more urination. So in the past, this is a very, embarrassing problem, and a lot of women don't receive like a good effects. And today, we have like a non-invasive treatment, which is very effective to the women there. And in women's vagina, then we got some like fibers inside, and we activate all the cells. And so we rebuild the vitality of like a lady's vagina to make them really healthier. So it helps in their frequent urination. So I think this is very, very practical information for ladies who are kind of older. And today we have a professional doctor with us today. And please get online. And sometimes, so we just give a little bit help, and we can transform their lives into better ones. Okay, especially today, our information is really, really practical for ladies, okay, who have such problems, right? If you go to the right doctors, then you are really lucky and solve, ladies' problems. And that is why Dr. Xu, is here today. And we are looking forward to receiving more information and knowing more. And if you feel uncomfortable, you can just take some painkillers. And the pregnant lady, ask about the COVID-19 problems and the vaccine. And this is very important, right, for any pregnant women, whether they have to take the COVID-19 vaccination or not. And Dr. Xu has been asked about this for many times. And today, so let's have Dr. Xu with us today. And he is from Dalin慈济Hospital. And today, let's say we are lucky that we like to be with you because you have a positive energy. So Dr. Xu, please.
因为您有正能量。好，君硕主任，你
And today, we have a Dr. Xu with us, and thank you for coming, getting online today here. You are so busy, and we occupy, 30 minutes of your working time. And thank you for taking care of ladies for us. And today, please, share your information with us. Ladies and gentlemen, good morning. I am Junshuo, Dr. Junshuo. I'm a director of obstetrics and gynecology of Dalin慈院Hospital. And today we're going to be talking about the new trends in the treatment of the uterine fibroids. And this is a very common problem for ladies. And today we're going to be talking about whether you need operations or you just take medicines. And today, I'm going to be having my report today all about this. And today we talk about the uterine fibroids and how you're going to be treating, such disease. And this is a really common problems for ladies. And it happens in women around 20%, okay, in middle-aged women. And as your age grow, and the possibility also increases. Okay, like 45 to 50% for more aged ladies. And we have like a high percent of the possibilities that, the fibroids would occur. And usually you don't need operations because they will just wither, they will just shrink naturally. And 80% of the women's wombs that have a fibroids inside, and they are tiny as 20 millimeters, but they will grow by 10% yearly. And in the United States, like 20 to 40% of the fibroids would be caught because they were diagnosed as like a uterine fibroids. So we have a variety of treatment for such like a uterine fibroids. And today, I'm focused on this, like whether operations is needed or you need like a further treatment. So first, let's talk about what kind of a lady may have the fibroids most commonly. And it happens mostly when women have their first period. And because pregnant women look have a high percentages of the hormone, so it is more likely for them to have such a symptom here. So your fibroids may grow. And for menopause ladies, and it is very, very less likely that they have like a fibroids because of the lower hormones. Okay, so they will remain the same. And for the period, okay, for ladies, a period that comes earlier, and because in the fat contains a lot of hormone, so it will help the fibroid to grow. And there are the possibilities that help the uterine fibroid to grow. And for women who have less exercise and more smoking, and it is very dangerous for them because it also increases the danger of the fibroid. And we also need to concentrate on the progesterone, okay, and all the pesticides thing here in our environment, and it is really, really very likely that you have the uterine fibroids there. And also, food would also cause such thing to happen. If you eat a lot of raw fish roll, like shrimp eggs or crab rolls, and this is very, very likely to have the uterine fibroids. And again, as I mentioned, the plasticizer is also something dangerous. Like if women get in touch with a plastic products, like plastic bags, like a shower gel, or a lot of materials made of plastic, or a soap, like shampoos. they all have a plasticizers in that. So it causes, a possibility for uterine fibroids to grow. Okay, although it is kind of gradual, but it would happen. And if you eat meat, or you eat hams, or you have alcohol, and it is kind of a risk factor too. And if you can absorb vegetables or vitamin A, like a soybean milk, right? And they are okay, but for soybean milk, they contain also a little of the risk factors for uterine fibroids because it has somehow kind of predecessors in that. Okay, and let's talk about this kind of chemical named DEP. Then you will see them mostly in perfumes or cosmetics. Okay, and they are the products maybe banned in some countries, and including the United States. Okay, as well as Taiwan in recent years, right? And some products which are especially good smelling, they have some kind of a DEP inside, which may affect our health for you ladies fibroids to grow. And let's take a look at the fibroids. And here we have one that is out of our ovary, okay, or inside a womb. And also we have a tumor, okay, around the cervical parts, and they will cause different symptoms in different places. And you can see we have three kinds of different fibroids. We have fibroids around your mucosa and your serosa and the muscle layer. And they will just cause a lot of problems, including a lack of blood there. And some mucosal fibroids, and in this case, the fibroids are growing inside the uterine space, which is the cavity where a body grows during pregnancy. Think of the growth extending down into the empty spaces in the middle of the uterus. And we also have the intramural fibroids. And these fibroids are embedded into the wall of the uterine itself. And picture the size of the uterus as the walls of a house. The fibroids are growing inside the mucosal wall. And we also have some serosal fibroids located. They are located on the outside part of the uterus at this time. And these fibroids are connected closely to the outside wall of the uterine. And you can see all the pictures of the fibroids. And maybe in ladies inside of their wombs, and they have so many fibroids there. And if the symptom gets serious, then we will think of cut the womb off. Okay, and what kind of ladies need such treatments? And treatments for uterine fibroids can vary depending on the age, desire for pregnancy, percentage of malignant size, number, and the locations of the fibroids, as well as what symptoms they are causing. And if you only experience any symptoms from your fibroids, you may not need treatments. And we also consider your age, and if you are around 18, 19, and this is a very, very a dangerous period of time. Okay, and if for aged ladies, and the best treatment option for them will also depend on their future fertility goals. And if they want to have children in the future, some treatment options may not be an option for you. Well, for ladies who already, get away, are aware of the menopause and the fibroids still grow, and we have to say this may be problems that we needed to concentrate on. So we have to continue tracking on these fibroids. And whether they need treatments or options depends on different women's physical situation, depending on, for example, your ages, their ages, and the growth rate of their fibroids. And how many treatments do we have for such a fibroids? Okay. Well, and we can have number one, a follow up on a regular basis, and we also have medications. Okay, and we just take a medicine and keep tracking on that until it just gets shrinks. And number three, then we can have the uterine artery embolization, and we can just have the kind of treatments that just decreases the blood offering, and the fibroids may just get shrinks by itself. And we also have a Da Vinci surgery here, and we also have the laparoscopy. Okay, and if the fibroid location is pretty weird, then maybe we have some other treatments. And we have the latest HIFU. HIFU means a high. Okay, this is a HIFU. Okay, and we have that. Okay, symptoms, and we can just cause a lot of blood problems, like a lack of blood for ladies. Okay.
And we can also consider taking medication, and we could stop the bleeding, and also we could also have a GnRP. It's a hormone agonist, and it would also help us stop bleeding. And when you have the treatment, the medication would take via injection, and sometimes you might grow osteoporosis when you take this medication. And also after you stop taking the medication, you might the fibroid might grow back. So for women who were before menopause, they could take this GnRH. It's a hormone agonist. They would just naturally grow into menopause. That would be natural. But for younger women, we sometimes we would reevaluate whether they are suitable for this treatment. And also we have another treatment for surgical treatment, and you could have hysterectomy. Hysterectomy is to remove the whole uterus, and if you only remove the fibroid itself, it's very possible that the fibroid will grow back. So if it depends, the treatment option will depends on whether you are planning to have to give birth to children in the future, and before the you're having period, your uterus will enlarge, and so there's a hormone, and if there's the location is in the uterus, we will go through the vagina and the cervix to have the surgery, so that you won't see an incision. You your ab won't be cut open, and you won't see incision or you won't see scar on your ab. So there's another option is in endometrium ablation. Endometrium ablation. This treatment that you could it would there's ablation on your internal uterus wall, and you can use this kind of treatment repeatedly and until you reach the menopause. The hormones start decreasing and the fibroid will shrink automatically on itself. And there are many kinds of surgical. And on the D, we could use the laparoscopy myomectomy to remove the fibroid, and we could also use the transcervical resectable. It's called TCR. It's a surgical treatment that is useful for observing the uterus cavity and resecting the intrauterine tumors. And there's another kind that you won't see incision is the vagina hysterectomy. Your uterus is removed through an incision on the top of your vagina. There's no external incision. The laparoscopy myomectomy, you would use a small tube to go through your belly button, and so this incision is very, very limited, and that's and you will be able to see that from this abdominal surgical procedure, and you could be able to see the vaginal hysterectomy. You won't see the incision on your ab. And the vaginal hysterectomy, your uterus is moved through an incision on top of your vagina. There's no external incision, and these soft stitches are placed inside the vagina, most commonly used in the use of uterus prolapse and the other malignant conditions. Fewest complications and fastest recovery because you don't see incision. Because many women, they do not want to see incision on their ab. So this is their first choice is vaginal hysterectomy. And we will be able to see that there are many kinds of various surgical treatment. The traditional abdominal myomectomy through laparotomy, and also there's the laparoscopy myomectomy, and also the vaginal hysterectomy, and the recovery period are various, and the vagina hysterectomy are the treatment that you don't need to stay in the hospital for you need to stay in the hospital for only 3 to 4 days, and it's the least painful treatment. And also, and there's an intrauterine adhesion. This intrauterine adhesion, this is during this procedure, an incision is made in your ab, and the fibroid are removed through this larger cut. So you will be able to see the incision on your ab. But because of your condition, if there is severe adhesion, you only have this option, that is a laparotomy. And the HIFU, HIFU. You use the MRI to locate where the fibroid is. Before you is executing FIFO treatment, prepares MRI aspirant patient position is necessary to allocate the exact anatomically position and the tissue composition of the uterus fibroid. When we evaluate the uterus fibroid and the target volume, as well as the accessibility of the FIFO beam is made, and then the target volume is defined, it is then sonicated step by step as cluster, or so-called the treatment cell 4 to 16 millimeter in diameter. And due to the acceleratory movement of the ultrasound probe, as well as using dynamic focus of the 5-foot beam in the outward movement and concentrating circles, making the volumetric sonication, these predetermined treatment cells can be feasible. So there's a 5-foot treatment, and when you have the if you use this you want to use this 5-foot, you have to pay on your own from your own pocket about 160,000 NT dollars to $200,000, and the comparison of this treatment for the 5-foot treatment is an ultrasound treatment, and you won't see any incision or wound. That's the benefit of 5-foot. And you will still have the function of the uterus and your ovary, and you don't need to stay in the hospital for too many days. You only need to be hospitalized for 3 days. But it's expensive. You have to pay out of your own pocket. And this 5-foot is not suitable for women who has cancer. And this treatment is newer. And then the last, and the uterus fibroid, you don't, most of women with fibroid don't need any surgical treatment because the rate of it would turn into cancer. The rate is around 0.3%. And when you have when you have symptoms, you will have to start treatment. And also, there's another option is surgical treatment. And surgical treatment, you have to if you cannot stop bleeding, you have heavy bleeding when you have your period, and you start losing too much blood, you have to use surgical treatment. And it would depend on the location of the fibroid and to choose the suitable treatment. And if we have to evaluate whether there's adhesion, if there's adhesion, we need to use consider other treatment. And there is a 5-foot option. And in the next year, we will use a 5-foot in Daling慈济Hospital in probably next January or next February. And this high foot, you don't need to go through like a surgical procedure. You won't be able to see wound. You are not cut off on your app. And these are the symptoms of uterus fibroid and the treatment of introduction to the treatment. And I'm very grateful for your listening patiently.
Thank you very much for Dr. Shi's a wonderful presentation today. And I hope that on the screen that we can also take our images in Kaohsiung. And I want everyone that can see me. And here, Dr. Shi tells us also something that calms ourselves down. And we have such an operation named HIFU in our hospital that can protect ladies just like us. And we, had the images later, like Dalin慈济Hospital, also make Mr. Zheng Yuan feel very, very peace because they had a presentation in Hualien. And in there, to safeguard more people's health, and all the hospitals would just do their best and provide as good treatments and remedy as possible they can. So we have some messages here. Then we have messages here saying that Dr. Xu gives a wonderful presentation, and the women's problems are kind of embarrassing. And today, they learn much about whether they need operation or only medical treatments here. And also, I'm working out here, so would you please, just, let everybody see me and Dr. Xi, and maybe you cannot see us here in Kaohsiung, but now through our online streaming, and maybe you can just watch the recap. And today we have Jinshu from Thailand saying that this is a very, very wonderful presentation, and it really solves our personal problems, and we feel you are loved, and which eliminate the obstacles in ladies health and a frequent urination, and this is also a very impressive problems for ladies, and we won't go to the doctors unless the problem goes really serious. And we have one patient from Taipei. She says that he says that I am like a Dr. Xi's patient, and many years ago I was a training volunteer in慈济, and when I went back to Dalin, and I had an operation by you, and it hurt. And I just wouldn't like go to work, and because of Dr. Xi's treatment and the problems were finally solved, I'm so grateful to Dr. Xi here. And this is wonderful. This is a gratitude from Taipei toward Dr. Xi, and this is very professional. And we can know more about our own bodies and know how to treat, our like personal problems. Okay. And in Tzu it's like a Dharma missions, and we have a lot of professionalisms. And through our like sharing from the doctors, and we really learn a lot. And so it is very wonderful if you can just like share our like online study group, okay, with all the people around you. And let me say this, Dr. Xi has a very wonderful voice, and I enjoy listening to him. And Dr. Xi to sing? No, I don't actually. But your voice is beautiful. And I like your voice, and it really makes a lot of people feel comfortable, when we are listening to you. Thank you very much, Dr. Xi. And please dump for us and share this great information around you. Okay, then we have Andy, and we also have messages from Mongolia, and we have Dennis Chai.